Hello, my name is Leo Malman. I'm a nurse practitioner student at Maryville University. This is Corey. Today we're going to do a chest, lungs, and cardiac exam. We're going to start off with inspection. I'm inspecting Corey to make sure that his chest is symmetrical, that there's no lumps, masses. His color is uniform front to back. He has no work of breathing. I see that he has no visible venous structure and that he is well nourished and has no extended ribs. No misshape there. We're watching now and have been watching. He is at 16 breaths per minute at a nice even slow pace. We are no accessory muscles, no work of nares. I'm listening to hear. I hear no any extra wheezing or breath sounds that I wouldn't expect normally. He doesn't look like he's in distress. We will go ahead and do landmarks. His trachea is midline. It doesn't deviate left or right. His substernal notch. We come down. We have angle of Lewis. We can come down to a xiphoid. At that point, we can feel in and get the acostal angle. Take a deep breath for me, Corey. And you can see how that spreads as he breathes in one more time. And that is normal there. We are checking there. We will do the C1, the T7 in a moment. But what we're going to do now is we're going to palpate. Tell me if any of this hurts.
No.
Very good. No crepitus, no bumps or no crepitus at all in there, and no pain. That's normal on the sides. I need you to say 99 when I touch here.
99.
And again.
99.
Again.
99.
And.
99.
Very good. It was palatable on both sides, palpable on both sides. It was even, and it had a good resonance to it. We're going to go ahead and check the chest expansion was fine. We'll come around the back on this. We're checking for down the the scapulary line. Any pain or problems there?
No.
Very good. Very good. We're going to go ahead and palpate. Again down the subscapular line, listening for any change of tone. We'll come around. I'd have you lift up your arms, please. That all sounds fine. Go ahead and put your arms down. Sounds good. We're going to go ahead and oscillate at this point. You need to take a deep breath. Good. Good. Very good. That sounds good. No unexpected sounds there. I'm going to have you stand up and turn around. At this point, I'm going to listen to your lungs on this side. Again, we found the C7. And we'll come back to that. But deep breath for me. And again. Again. So again, C7, T1. We come down to the T10. Deep breath. And very good. Very good. Next, what we're going to do is we're going to check for your diaphragmic expansion here. So what I want you to do is take a few breaths. And pull it in and hold it. All right. Other side. Deep breaths. In and hold it. Good. All right. Next thing I want you to do is take some regular breaths for me. Next, I'm going to have you breathe it all out and hold. All right. One more time. I palpate up until I hear the resonance from the denseness, and I put a mark in there. All right, breathe normal. If I come in from my marks, that one's at 3 centimeters, and that one's at almost 4 centimeters, which is normal, between 3 and 5 centimeters. You'll notice that this is higher than this one, and that's because of the liver clearance that we have here. All right. One more thing, we're going to have you turn around. I'm going to listen as we go. Say 99.
99, 99, 99, 99.
Very good. That's even. It's muffled, but it's even but audible. Let's go ahead and have you sit down. We're going to go into the cardiac portion of this. As we first start with inspection, we're looking for any apical impulses, any palpitations, any thrills, rises, or heaves. Lean forward a little. I don't see any, because of his muscularity and size, I don't see any impulses. Also, at this point, I'm going to state that because of this, I was not able to palpate Corey's heart size. In this case, we'd send him out for an x-ray, chest x-ray. Normally, if we were going to do that, we'd start axial and palpate into the sternal line until we heard. We'd put a mark, we'd do both sides, we'd have the base, and we could also do the same thing into the apical spot, and that would tell us approximate size of Corey's heart, which is huge. So anyway, next we will go ahead and have him lay down. We're going to palpate for our apical impulse. We're going to look between the 4th and 5th intercostal space, subclavicular. And there it is. Not pushing too hard. Going to have him turn his head just slightly to the side, and we're checking for carotid pulse if it matches. And that it does. As we palpate here, we're noticing any rise or thrills. We go left sternal, base on the left side, base on the right side, right sternal, and don't notice any abnormalities there, no thrills or rises. I'm going to go ahead and listen at this point. We start at, this one is the aorta, pulmonic, second pulmonic or herb, tricuspid, And mitral or apic. Going to check pulses. We do that for a full minute. In this case, I'm only going to do 30 seconds. And multiply it by 2. All right. Next, I need you to turn to your left side here for me. His heart rate, by the way, was about 58, which is pretty good. He's working out quite a bit. We're going to go ahead, feel palpate again. Same spots before. Apical, left sternal, base, base, right sternal, sternum. And we will listen again. Aortic, pulmonic. Second pulmonic. Try, and we'll go back. I'm going to have you hold your breath for me for a minute. All right, I'm going to have you go ahead and sit up. His sounds were normal. I heard no clicks, snaps. I heard no rubs or murmurs. If I had heard murmurs, I'd be looking for the 9 qualities: duration, length, location, when it happened, and the quality of the tone. I heard none of those. Everything was well therein. Corey's a healthy young man. We'll stop this now. Thank you.